by a lay analyst, L-A-Y, we mean that he was an analyst who was trained in psychoanalysis but was not a medical doctor. And some people thought, especially in America, that really to properly be an analyst you had to have medical training because it was the province of a doctor to be the one that was providing treatment. It was, you know, that people thought psychoanalysis was well melded to the medical model, and that was necessary. However, Freud, the great master Freud, said exactly the opposite. He really felt he was very much in favor of training lay analysts, non-MDs to be analysts. And so what you find is that in Europe, you have a tradition of lay people, non-MD people, being trained as analysts. When you come to America, when psychoanalysis comes to America, it's taken up by the MDs, and they essentially, up until the late 1990s, they essentially block training from non-MD people, psychologists, psychiatrists, counselor, people with counseling degrees, social work degrees. There's a few here and there, a few PhDs, a few MSWs who get some analytic training, but it's fairly rare, and they create a separate kind of analytic training, a research analysis, you become a research analyst where you're not really practicing seeing patients, but you go through the analytic training so that you can become a researcher. Some of those people are allowed through, but it's very difficult for other kinds of mental health workers, non-MD people, to get analytic training in this country. When I was going through my training, there was a lawsuit filed by the American Psychological Association against the American Psychoanalytic Association for restriction of trade, saying that you can't just train doctors, you got to also open up training to psychologists. And they won that lawsuit. The APA won that lawsuit, and the analytic institutes did nothing. And so they had to go back and sue them again. And by this time, what a bunch of PhD psychology people said is, well, screw them, we'll open our own analytic institutes. And so what happened is that they started opening up their own analytic institutes that were geared toward training psychologists and social workers, other people. And in Northern California, where I'm from, they set up a separate psychoanalytic institute called PINC, Psychoanalytic Institute of Northern California, that ran in parallel to the traditional Psychoanalytic Institute, which wasn't accepting PhD people. But they sued him again, and then what happened was something very interesting, is that people in this country people going to medical school stopped wanting to be psychiatrists. The number of people going into psychiatry dwindled down, and so you have almost nobody who goes to medical school now going into the specialty of psychiatry. So if you're a Psychoanalytic Institute, because not only, and of those people going into psychiatry, even fewer are going to go and get analytic training. And why is that? Because you make a lot more money prescribing drugs. I can see 4 patients in an hour, and I can charge $350 per patient. That's what, $1,400, as opposed to seeing 1 patient in the hour. Maybe I can charge them $250 or $300 if I'm a psychiatrist. So the amount of money to be made prescribing is 4 times as much. And so what happened in professional psychiatry is they have now really most psychiatrists just do drug prescription. Very few do psychotherapy, unless they're really old school. Like my dad's a psychoanalyst, he's a psychiatrist. He's never prescribed a drug in his life. He just does psychoanalysis, right? But he's old school, he's almost 80 now, right? And if you go to the Psychoanalytic Institutes, what you see is, on one side of the room, all the old gray bearded guys, mostly guys, or the old guys, are all MDs. And then you see on the other side of the room, all the young people, most of whom are women, most of whom have a PsyD degree, and they're now being trained in psychoanalysis. Because the Analytic Institutes realized unless they let in psychologists and social workers and other people, they were going to die out. And so now you see this very interesting, I was down in LA at the Psychoanalytic Institute there for a lecture, and you see this interesting split in the room. It's very interesting. The old guard, the old men, who are all MDs, and then the young people who are mostly women with psychology degrees. Very interesting. So that's kind of the way it is now. They realize in order to survive, they were going to have to open up. So now the good news for you guys, if you go on for clinical training and you like the psychoanalytic stuff, you can go on and get fully trained in psychoanalysis. The other thing the institutes are doing, and I'll stop this ranting and raving about this, the other thing the institutes are doing now is they're also having formalized programs not to train people to become analysts, but to train people to become psychoanalytic therapists, which is a little bit different. And it's a little bit, and the training is usually about 2 years, and they do it down here in LA. It's a Wednesday night thing. You do a Wednesday night, and you go for 2 years, and you get a certificate on being a psychoanalytic psychotherapist. And again, there's variations about how psychoanalytic psychotherapy is different than psychoanalysis. Depending on how you get trained, it can be different, and there's different people have different ideas about that, which if we had time we could go into. It's very interesting. But I've actually had a guy down at the Analytic Institute here, an old guy, in his 80s, who's an old school psychoanalyst, tell me that he thinks the psychoanalytic psychotherapy program is better than the psychoanalysis program. He said, I teach in that one. It's better. They get better training. They'll go figure. Yes, Julie.
Is that one a PsyD?
No, the PsyD is the degree you get. Now, I don't want to get complicated. They actually do offer, I think, a PsyD down at the Analytic Institute. They have a doctoral program there. You can go there and get your doctorate. It's not accredited by the APA. So the problem is, if you're not going to be a psychoanalyst, you're going to go and try to get a job as a psychologist. So you can still get licensed, I think, in California. I think still. I'm not quite positive about that. But you can't, but a lot of jobs in psychology, clinical psychology jobs, require you to have an APA-approved degree. And if you don't, you're SOL, right? I don't have an APA-approved degree, so if I wanted to apply for a job at the VA hospital, they wouldn't accept me. Right? It's again, we can go on. I can get on my soapbox and rant and rave about that, but PsyD degree is a degree. It's just a degree, and it's modeled after the MD degree. You had before clinical psychologists were getting PhDs, which is a research degree, and the idea was that you would be a clinician scholar, right? And in my opinion, you end up being half-ass clinician and a half-ass scholar. I don't think it's very successful. And the APA actually, in the 70s, decided that that wasn't a good idea, and so they started promoting the PsyD degree, where you become a really good clinician, and then if you want to go on and do research, you would do postdoctoral work like you would if you were an MD. And that's now becoming the preeminent clinical psychology degree. I think about 70% of clinical psychologists now have a PsyD degree. You'll find my academic colleagues here with PhD research degrees look down on the PsyD. They are, in my opinion, ignorantly prejudiced against it. And I could talk to you more about that. Read my guide to applying for graduate school. It's on the Psych website. I wrote a little bit about that in there. You can read about that.